Today on Let's Talk Jonesboro, we have two guests from Encompass Healthcare, and it's Ashley Watson and Shanda Henry. Welcome, ladies.
Thank you. Thank you.
I know we're here to talk about stroke awareness, but before we do, let's talk about Encompass and all the things that you guys do.
Okay. So Encompass Health Rehabilitation Hospital, we are an acute inpatient rehab facility. So we specialize in physical therapy, occupational, and speech therapy. Our patients actually range from, stroke patients to amputees, Parkinson's, any type of neurodeficit that could be benefit from being in inpatient rehab, to just generalized weakness, patients that have two skilled needs that need our services.
Okay, very cool. And now, Ashley, you're the nurse liaison, and Shanda, you're an RN, but you're also in charge of the stroke facility.
I am the chairperson for our stroke committee.
Okay.
We just kind of meet monthly to see what improvements we can make for that committee.
And the reason we have that committee is because we are the only disease-specific center of excellence in Jonesboro in Northeast Arkansas. So Joint Commission is a certification process that you have to go through all kinds of fun stuff, right? But we have to show them what we're doing, not only on paper, but they have to see that our patients are truly getting everything they need. So those monthly meetings came about because of that particular program that we wanted to be.
And so you have, you involve doctors, you involve, I guess, occupational and physical therapists.
Speech.
Speech therapists, and obviously the nurses.
Yes.
We use a very interdisciplinary team approach to caring for our patients.
And a stroke can cause little to great damage, I would assume. So you have
Yes.
patients that run a spectrum.
Yes. Depends
Yes, sir.
on how much damage the brain has happened to the brain once the stroke has happened.
Well, before we talk about dealing with patients who've had stroke, tell us about how strokes occur and if there are any ways to prevent, or I know genetics play a large role, but what do people need to know?
Well, a stroke is any time there's an interruption of blood flow to the brain, first of all.
Okay.
And then there's two different types of strokes. You can have an ischemic stroke, which is typically caused by a clot. Most of the time it's a clot that they can travel from your heart, anywhere from your body, even within the brain. So a clot is the most common type of stroke. About 87% of strokes are ischemic. Then there's the hemorrhagic. A lot of times we hear those as the brain bleeds. And so that's where the vessels, the arteries have possibly ruptured, and so there's blood going to parts of the brain that's not supposed to be getting that blood. And then there are something called TIAs, and everybody hears that as mini strokes.
Correct.
Mini strokes are not something to take lightly. If you do have a mini stroke, you need to seek attention just as you would if you were having the signs and symptoms of a major stroke. Over a third of mini strokes turn into major strokes if not treated. So it's very important to make sure that you are getting the care and following up after having the mini strokes. The difference with the mini stroke or a TIA and a major stroke is that the TIA typically goes away within 5 minutes.
I see.
So.
But does it have any lasting impact, the TIAs?
The TIAs, if you have multiple, it can have some impact.
And are TIAs more common?
I would say they're just as common as major strokes. I don't know the statistically.
They're oftenly known as the warning strokes.
Right.
The warning stroke.
The warning sign. Mm-hmm.
Okay. So once you've had a TIA, you are more likely to have either another TIA or a full
Right.
stroke.
According to CDC, if you have a TIA, you're going to have probably going to have a major stroke within a year. So it's
Okay.
definitely the warning sign to pay
Are there
attention
any
to.
health habits that people need to be more aware of?
Absolutely.
Okay.
Just from smoking.
Smoking.
Smoking is a big contributor to something you can actually do something about.
Okay.
So where you lose oxygen, that can cause your blood to become sticky. Where you have sticky blood, there's your clot that develops.
Huh.
So smoking is one of the biggest ones.
Sticky blood does not sound like a good thing.
No, it's not.
So,
It's not. And so also just limiting alcohol.
alcohol. Okay.
It's okay to have occasional drinks, even a daily drink, but just not to exceed what you should be taking in on a daily pattern.
I see. Okay. So now, once you guys are an inpatient facility, so who qualifies, Shanda, who do you see? Will it be someone who's going to be there for just a few days, someone who's going to be there for a month? What do you see?
That kind of depends on the progress that they're making.
Okay.
We often see patients come in for about 12 to 14 days after a stroke, but then that just really depends on how hard they're working, the gains that they've made, and there are times that they may be there longer.
Now, it's important. First of all, how do you know when you've had a stroke?
That's a good question. So there's an acronym that we use called FAST. Okay. The F stands for facial drooping. So if you look at someone and their smile is not symmetrical, or you notice that your smile is not symmetrical, it could be that you're having a stroke. The A is for arm weakness. Typically, it's on one side or the other. You don't typically have weakness on both arms.
Okay.
So that, and then the leg as well. So it's usually one side or the other. And then the S is for speech difficulty. So they have problems getting words out or coming up with words, or when they do speak, it's just garble. So it's just paying attention to those as well. And then T, time is critical. So we always say, if you experience any signs and symptoms of a stroke, make sure you call 911, get medical attention. Do not wait. And there's so many more symptoms of a stroke, from visual changes to sudden severe headache, and when I mean a sudden severe headache, not just your typical headache that might come on,
Right.
to loss of coordination, balance problems.
So you've got patients, and how intensive is the work that you do?
With inpatient, our patients will complete 3 hours of therapy each day, and that's with speech, occupational therapy, and physical therapy.
And so every patient's going to get 3 hours of therapy, no matter what they're in our facility for.
Okay.
But we're going to do everything from education to make sure they understand what's going on with them. Their medications are also going to be looked at, because they're going to be on medications after having a stroke, more than likely. So we include that in our 3 hours of therapy as well, making sure that they have all the necessities for when they do go home. But we have all kinds of different equipment too, though, to help as well in their therapy, from something called an auto-ambulator. It mimics the patient that cannot actually stand up on their own. They can be harnessed in, and they can walk through a normal gait pattern, to using something called BITS, where it works really with the memory. So you're able to match different things up. It's very very meticulous how you do all that stuff, and that's why we have those therapists. I always say, though, there's nothing like that one-on-one attention going from your therapist
Right.
versus just having all the nice stuff. It's great that we have that stuff, though.
Right. What are some of the hardest things to recover when you've had a stroke? What are some of the hardest things that you see patients deal with?
I know a lot of times when in our stroke support group, one of the hardest things for a lot of the patients in the family is just not being able to communicate the way they want to communicate, or it's the weakness, not being able to get up and go like they used to.
The loss of independence.
Yes, that's it.
Let's
Yes.
see. But now when you say speech, it's like lost words? Because I can't find the word I'm looking for a lot of the time.
Oh, same here.
Okay.
But no, it's, the loss of words, speech being slurred. And it may be that they are trying to communicate with you and they know what word they want to say, but they cannot get that word out.
I see.
So there's different levels when it comes to the speech, for sure.
What do caregivers need to know? What are the most important things that you tell caregivers?
To really give the patient time. It can be really frustrating when we feel rushed. If they give them time and allow them to kind of think about what they're trying to say or what they're trying to do before they do it, it kind of makes it a little bit easier for the patient.
Do they? I would assume that the caregivers, just like the patients, fear that they're not going to recover or that they're not making progress
Sure,
fast enough.
Absolutely. There is so many times that just yesterday I actually had my stroke support group, and I had a participant come in, and she was just beside herself. She said, "I came today. I didn't bring my husband that had the stroke. I needed this therapy." It's a time of change for everyone, not just the survivor, but also the family and the friends that are right there beside them, trying to help them in this process and being patient. Trying to be patient. Also tell the family and the caregivers, take care of yourself. Make sure that you are not overwhelming yourself.
Right.
When people ask and say they want to help, let them help you out, because caregiver strain is so huge in this area.
Imagine that's you're taking on a lot of responsibility and maybe feel a lot more responsibility than you should.
Right.
Sometimes.
Right.
Now, May being Stroke Awareness Month, what type of events do you guys have planned?
Yes, actually Wednesday, May the 15th, we're going to be hosting a community lunch and learn. I'm going to actually be talking stroke awareness talk, and so we're going to invite the community to come in to our facility at Encompass Health at 1201 Fleming Avenue.
Okay.
To be a part of that. We just want to raise awareness, make sure people understand what it is to have a stroke, to recognize the signs and symptoms of a stroke, and what to do if you do have a stroke. So we're going to be doing that. We'll be hosting our normal and monthly support group that we do host every second Thursday of the month. So we'll be doing that in addition. And then you'll be finding me everywhere, actually, that month, going to every senior center I can get to other facilities, just talking about stroke awareness. And if there's somebody that would want me to come, they can also contact me as well.
Now, I guess it's important to reach people who have not had strokes.
Right.
Because but it does not simply affect the elderly.
No.
You're never, I don't guess you're ever too young to have a stroke.
You're not. No, that's and that's a misconception that you're typically older. Strokes do happen more in the older population, but
Everything else does too.
Right,
Trust me.
right. That's like everything that I do educate on. That's always the thing. As you get older, you're more prone to have.
Yes.
So no, it's just not. It's not going to be picky on what age you are. We have plenty of 20 and 30-year-olds in our facility having strokes.
That's interesting. And can you talk about a success story? Shanda, tell me a success story that you've seen, someone that's come in and really needed some help, and how you guys have brought them along.
The one that really just comes to mind, she was right around 22, and she had been out with some friends and had a stroke and come in as an inpatient, and she was one of those patients who wasn't able to speak afterwards.
Oh my.
She quickly became one of my favorites, but I would poke my head in her door just to make sure that everything was going okay while her and her mom were there. And I know that one afternoon after I'd poked my head in, she was awake. Well, she had woke her mom up and said, somebody. Well, she finally figured out that she was telling her that someone had poked her head in the door. So now every time she sees me coming in from outpatient, she'll wave and say, "Hey, somebody."
Hey, somebody.
So she's come a long way.
That's fabulous. Ashley, do you have a similar story or anything that stands out?
There's so many. That's what I was sitting here trying to think of. All the patients that the reason I do what I do is because I do see these patients that are wheeled in on a stretcher, and they're supposed to never walk again. They're not supposed to go back home. Well, we get to watch them walk out of our facility, and that happens just daily, you know. So there's so many stories that I could come up with, but watching that and the independence and the family being able to, for instance, there's this one, a grandparent, he was able to walk out, and I got to watch his grandchild run up to him, and they were able
Really?
so that right there is, that's it.
can't
That's
put a
what we
price
do
on that,
while we
can
do.
you?
No, you
Yeah.
can't.
That's excellent. Tell us about your stroke support group.
Okay. Our stroke support group meets every second Thursday of the month at 1 p.m. The stroke support group is for survivors, but not only for the survivors, but for the family, caregivers, anybody that's a part of that. So we do anything from educational activities where I might have a guest speaker come in and talk about diabetic management, to understanding their medications. And sometimes we just have fun and play some bingo and fun activities and such. But that is for anybody in this area. It's free as well. We've been meeting for over 15 years. On a consistent basis, I will have 20 to 30 participants, sometimes more. And so it's just a great program where people come that have similar things happening to them, to understand and learn from each other.
Tell us about some of the other services you offer.
Okay. We also do have a Parkinson's support group every month, amputee support group. But prior to the amputee support group, we actually host an amputee clinic that is free for the community. On a typical day, I will have, on that one day a month that we do have that free clinic, I will see anywhere from 20 to 30 patients in a short time span. We have a physician that comes in there, an orthopedic surgeon, that will come in and look at the patients. So we have the nurse. I'm the nurse that takes care of all the wound care. Any social work that might need to be done, any case management, I'll take care of that. And then we have a podiatry group that comes in we got to take care of that other foot too. And then we also have a prostatic company that comes in. So the whole idea behind that is we have all those different disciplines under one roof where that patient doesn't have to go to all those different places to get what they need. Of course, we have a therapist down there as well. I don't think I mentioned that. So it's a great program that we get to service our patients that are in need, that might not know they need to have all those particular things happening for them. So we have so I just mentioned the Parkinson's and the amputee program. We also have the a lymphedema support group that meets once a month as well.
Okay, explain that illness to me.
Okay, lymphedema is where a patient may have swelling of unknown source where the fluid buildup has happened. A lot of times you will see this after maybe a patient has gone radiation. And they've gone through cancer treatments and such, and they've had lymph nodes removed. So then they have lymphedema that might come up. It also, but it doesn't. Lymphedema does not have to be in the arm. It can be in the legs. It can be in the abdomen, wherever there's been some scar tissue, some trauma. So we have we found that there was a need for the lymphedema support group as well. I know I'm forgetting some other support.
Power Up with Parkinson's.
Yes, with our Parkinson's program, we actually, with that support group, we also have a Power Up class that we host once a month that's free as well for the community. It's the first Saturday of the month. And then we're always offering educational opportunities in the community, and to healthcare professionals. Just got done hosting actually a big symposium where we had 100 and plus in attendance, to provide education to the healthcare professionals.
So you guys serve a lot larger region than just Jonesboro.
Absolutely. We're all over Northeast Arkansas up into Missouri. We're everywhere for sure. We do. We have patients that come from even Central Arkansas.
Right.
Mm-hmm.
Is there any advice you have for people that, just based on what you've seen, as far as now we know, lay off the cigarettes, go a little bit light on some of the alcohol, any other just habits, health habits that you
Diet
guys-
and exercise.
Yes.
Diet and exercise.
Definitely some type of exercise program if it's just getting up and getting out of the house and walking. And
Keep the
then-
blood flowing.
Yes.
It's like American Heart Association, it says 30 minutes a day. And,
Mm-hmm.
you know, if you have not been exercising, you know, doing 5 minutes here, 5 minutes here, that's okay too. Build yourself up.
Everything's a start.
And they always say, you know, eat your fruits and vegetables. Eat a good healthy diet and
Even
you're
that
okay.
plays into stroke. I mean, that's the
So
general
heart health is in the brain, everything works together.
Okay.
But you know, sort of some other things though, as far as if they're on medications, making sure they take the medications that are prescribed. I have a lot of times I'll be out talking, and they will say that I'm on blood pressure medicine, but I don't think I need that blood pressure medicine anymore, so I just stopped taking that medicine. I'm just like, oh, no, your blood pressure was under control because you were on that medication.
Right.
So really staying on your medications as prescribed. So if you have high blood pressure, take that medication. If you have high cholesterol, make sure you take that cholesterol medication. So that's so important.
Yes. What other factors are important?
So knowing their numbers, we always say know what your blood pressure is running. So if you make sure you go to your doctor's appointments.
You know, they change these numbers. They tell you as science progresses, we learn that the different numbers are better. And I think a lower blood pressure may be better than what I was told 15 years ago.
Right.
What is a good blood pressure?
They say 120 over 80.
120 over 80 is the
120
target.
over 80 is your target, but you know, it's different for everyone. So knowing what your number should be at, because I've seen some people, their blood pressure typically runs a lot lower than that, and they're healthy. So if that's your healthy number, and then you come in and your blood pressure is 120 over 80, so that might be an elevation for you. So knowing that.
What are some other numbers that are important?
Cholesterol.
Cholesterol, and what's a good health? Well, you've got good cholesterol and bad cholesterol.
Right, you do. So you have your, but knowing your triglyceride level 200, correct?
200 or below.
200 or below is what you want your cholesterol level to be at.
Okay.
You got us.
Okay. Because it's hard to know what's good and what's bad and whatever. So I do
Right.
good to know what my temperature is, and that's usually based on the thermostat, I think.
Right. And if you're diabetic, making sure you manage your diabetes, with whether it's taking medications or if it's diet alone, whatever your physician, we always say what your physician has said to do, make sure you are doing that and monitoring those numbers.
Are diabetics more prone to stroke?
Not necessarily,
necessarily,
but
go
anytime a
ahead.
person is diabetic, they're more prone to any type
Okay.
of other issues coming up.
Comorbidities.
Yes.
Okay. Okay. Well, ladies, thank you so much
Well, thank you.
joining us on Let's Talk. We've had Ashley Watson and Shanda Henry, and they are from Encompass Health. Tell us, Encompass is a new name for us, but you guys have been around.
Yes, we have formerly been known as Health South Rehabilitation Hospital for over 30 years. As of January 1st, we actually changed names to Encompass Health, and that was just because we bought other facilities up north. We're nationwide, so to encompass it all now, we're Encompass Health.
Very good. And people can reach you by going online to what?
EncompassHealthJonesboro.com is our Jonesboro website.
Okay.
But also, if they need to get in touch with us, if they wanted to be added to any of those lists that I just mentioned, all those support groups that I do a mail out every single month,
Okay.
they can contact me, Ashley Watson, at 870-932-0440, or they can email me at ashley.watson@encompasshealth.com.
Wonderful. Ladies, thank you for taking the time to visit with us on Let's Talk Jonesboro.
Thank you.
Thank you.
Thank you so much.